Hello, my name's Etta Tomla. I've got it wrong already. Okay. Hello, my name's Etta Tomla. I'm from the Research Council for Complementary Medicine, and I'm here today with Charlotte Gray. Hello, Charlotte.
Hi, morning. Nice to see you.
I wanted to talk to Charlotte today because she was one of the joint winners for the oral presentation at our conference this year. So I was going to ask you, Charlotte, what was the focus of your research?
Yeah, okay, great question to begin with. It was looking at traditional complementary integrative medicine within end of life care, basically.
Oh gosh, that's a huge support, I would imagine. Is it being widely used?
So, certain elements are, but my interest was understanding how we can include sort of all the modalities because they're quite sort of specific in terms of the offerings at the moment. And I'm a homeopath. My background is homeopathy. So I'm quite keen to understand how that and other modalities, perhaps that aren't integrated as much, why that's sort of going on and what particularly the offering is at the moment.
That is really interesting. So is that what led to your research that from where you were, what your practice was, and you wanted to see?
Yeah, pretty much. And personal experiences with patients, family, friends that have sort of gone through that end of life care process and just understanding that there's so much out there that can help us, but we need to really respect the current frameworks that are in place and understand how we can actually work together and integrate it.
So what were your key findings from this?
Okay, so I basically just did an initial mapping exercise just to see
Wow.
within hospices, within the 42 integrative care boards, what their offerings were initially. And it's fascinating that there's so much amazing work going on, but particularly it was a lot of the therapeutic methods that were being offered, such as reflexology, Reiki, massage. And out of the 151 hospices, there was only 23 that were offering acupuncture.
Wow. Oh,
There
I
was,
didn't
yeah,
know.
and there was one that had an osteopath attached to them, and there was only one offering homeopathy. And it was quite fascinating, really, because I looked at the Pan American Health Organization, how they classified and defined traditional complementary
Yeah,
integrative medicine, because it's quite a difficult area to kind of understand
it
what's
is.
classed as it.
Yeah.
And they did an amazing study on how to classify based on sort of a thematic analysis. And when you look at it like that, particularly it is more thematic therapeutic methods that are offered in hospices as opposed to sort of traditional health systems like acupuncture or complex non-traditional health systems like homeopathy. So there was quite a gap, really. So I found that really, really interesting.
Oh, so is there something that can be done? Are you using this as a springboard to filling that gap? How do we? I'm a hypnotherapist, so
Amazing.
I was interested. I thought, hypnotherapy is not on there. I do know people who work in hospices, but I don't know the framework. And I thought, gosh, wonderful the work that is being done, but yes, it looks like there are things that could be assisting that aren't. So yes, I was massively intrigued. So yeah.
Yeah, and actually that's interesting because that's what my PhD is about. So I decided to look at how we can really I'm interested in a framework, how we can
Yeah.
take what we're doing at the moment and the fantastic work, like you say, that's happening, and then saying, oh, are there leverage points where we could then say this could be an opportunity to integrate other modalities?
Yeah.
And for me, it's just about choice. It's about patient individual choice. And I firmly believe that if people don't know what's available to them, they
Yeah.
can't make those informed decisions about what could support their healthcare. So it's just about, for me, understanding how we can kind of bring everything to the table and then say, this is the choice, basically.
I think, yes, it is fascinating, isn't it? I remember at the RCCM conference a couple of years ago, there were some things around cancer treatments that I hadn't heard of. And I thought, gosh, why haven't I heard of this? And I work in this arena.
Yeah.
And if you're in the general public and you find yourself in that position, where do you start? Where do you look? How do you know what might support you? And there's not a one size fits all approach, is there? We're all
No, definitely not. And that's why we've got these modalities and
yeah,
everyone has their
yeah,
specialities
yeah,
and literally they do complement each other, don't they? Which is why we have this word and this
yeah.
integrative. But I think there's just a mismatch at the moment with so much on offer. And it's just creating almost like a bit of a standardized framework that supports everybody in that kind of best practice. And so that really underpins that, I don't know, that autonomy really for the individuals to go, actually, I would like to try that, or I would like to try that.
Yeah. So any thoughts on how that would work?
So, in terms of going forward with a PhD, I really want to understand what's currently in place
Yeah.
because, again,
Yeah.
nothing is about reinventing the wheel. The
Yeah.
people, the experts that are already working in end of life care. So, I really want to understand their views on what's working, what isn't working, and the possibility of how we could integrate these other modalities in. And just looking at it from a whole kind of system view, like a critical systems thinking, kind of
Yeah.
like pulling it really back and just understanding that kind of replication of the individual, but within the whole, as opposed to sort of more fragmented. That's what I'm really interested in.
That is interesting. Did you find that there was one particular therapy over all others that was the most go-to in those?
Yeah. So reflexology, top of the list. Fantastic. That was literally on all the websites and the documentation. Reflexology was the one that was coming up the most.
Yeah.
And then massage was quite high up as well, and Reiki. And often you get a lot of practitioners that are offering multiple therapies because they're trained in them, which is fantastic, so that they can offer multiple therapies.
And what was the basis of it? Is it about there's more research in those areas to back it up, or is it that they seem more familiar and more comfortable to people? Any thoughts on that?
Yeah, I don't know. And that's something I'm really interested in exploring because understanding how certain modalities are chosen over other modalities, I think is really key to seeing how we can get that proper evidence base in to
Yeah.
say, well, actually, we've now got this knowledge of evidence. So could we look at that particularly to
Yeah.
integrate that? So it's something I'm really passionate about finding out. What are they doing? Who's making these
Yeah.
decisions?
Yeah. And why and what
Right.
can we do to
Yeah,
open that up wider? Oh
absolutely.
yeah, I think that just sounds a really, really important piece of work that
Thank you.
um that supports the from the individual through right through the whole process, doesn't it? And
Absolutely.
the people who have this ability to maybe help people and that it's being missed. Um, and that's not to say, as we've already said, there's great work being done, but it's just choice. Would something else maybe fit someone else better, and what feels right for them? Yeah.
Absolutely. And it is building all the time, isn't it? We build on what we've already got in place. We build on that knowledge and then we just go, yeah, let's integrate in this way. But I think for me, I'm very passionate about that whole system approach. I
Yeah.
don't think you can just say, oh, let's just throw homeopathy in. It just
Yes.
doesn't work like that. We
Yeah.
have to consider the whole, don't we?
Absolutely. Although please keep in touch with us.
Yeah,
Let
definitely.
us know how it goes, because I think there could be some really interesting follow-up here in the future. Well, thank you for taking time to talk to me today, Charlotte. That's absolutely fascinating,
It's a
and
pleasure.
can only benefit moving forward, can't it?
Yeah.
Thank you.
Thank you so much for your time today. It's lovely to chat with you.
Thank you.